cause and recovery in medicines. But tell me the name of a medicine which has recovered a disease in this world. Find a single medicine which has recovered a patient. It's a disease created by the body and the body has to revive it. This is what the Hahnemann and other homeopaths also said, who were strong allopaths. Now you see there is a patient who was having sleep apnea and I recovered him by what? Inserting the needle over here. Which one? So you could see, even the sleep apnea for which we buy a very costly machine, can be revived by what? The simple needling treatment. Third order? So what did we do? Did we try to revive a patient? In my opinion, the life is revived. The quality of life deprived. The deprival of the quality of life was not because of anything else, because we did not understand the system of the body, how we eat the food, how it is digested, and how gut-brain axis works. And that is why we give excesses of treatment in ICU, we give excessive of treatment in elsewhere. And then post-strokely we suffer from what? Parkinson's. And then good luck to our many colleagues who advise aggressive treatment of exercise. With all due honor to them. Can aggressive exercise recover a patient? Can aggressive exercise bring neuroplasticity in the brain? So if you studied the last 2 days class, neuroplasticity is created with a series of stimulations, which is just like building your body. You go to a gym and you do hard exercise and your body is built up. But it is in a normal brain, not in a damaged brain. But what is your approach in a damaged brain for revival? Can you please explain me that what we have done up to now? So that part we have to understand and study, that revival of a patient and recovery of a patient are two different things. And relief is another thing. Relief, recovery, and revival. Maximum what we think is, a patient has recovered from this problem and the situation is solved. You can see here, I simulate the students after every 1 hour. You can see. Now you see the voice command, the way they are following. their parents. We can understand by this phenomena what recovery is possible. But what are the steps to be taken? Nowhere is mentioned. How to revive a post-stroke CBGD patient? How to work in post-stroke Parkinson's? Nothing is clear to us. We are only advised one or two tablets, and total system is dependent on this of maintaining the patient in on this 2 or 3 drugs. So, are we following a correct system? This is what the question of this class. Where are we lacking? What are we doing? And what we have to do? This is what we have to understand now. I simply understood the power of dry needling, and you could see, even in Hyderabad, I have treated more than 3,000 to 4,000 people in a year. Just with the help of dry needles, with minimal medications. Why can't it be done elsewhere? It is only the blockage of our mind that we don't want to learn, we don't want to do, and we don't want to work. Wherein this is not written in the book. Who has written these books? I don't understand. The patient is book or book is patient? So we know only up to this. We know only up to this. Why? You don't know after this? Well, it is not written in our books, and we. Then how did people went out to bypass surgery? It was never written. How did Kocher went to keratotomy? It was never written. How did Ipycherian wrote about cystostomy? It was never written. How did I write books on non-invasive brain stimulation? It was never written. How I integrated NIBS step needling on the uh, scalp at the first layer of the scalp can revive a patient. This is such a superficial needling with 0.25 mm needle can change the life of the people. If we bring all this into geriatric care, into CKD care, I think life can be done much better than what we are doing. If we bring all this in a chippy child's life, autistic child's life, I think we can do still better. But I never found out a person who really wants to do better. What better we want to do? Relieve the pain or the causes of the pain? It takes time. We have to give enough time because we have enough destroyed it. There are 20 reasons for pain. How much did you address? 3 or 4 reasons? When addressing these 3 or 4 reasons, you have what? Reactions? For whose reason? Because of the humanity has gone down. In our times, we still remember when we started our practice 30 years back, 25 years back, when I used to work as an acupuncturist in 9 or 10, I hardly used to hear a case of slip disc. If there was a answer called slip disc, there was a panic in our side. How slip disc happen? What is slip disc? Today you see, after 30 years, I see everyone is having what? HNP or exuded disc or caudal migration. Everyone is having nerve impingement. Why? Why it was not in our time? I just analyzed one thing. Today we are more on mobile, less on. Even our children are more on mobile. The best exercise they have done is this mobile phone. We are not on fields. Where are we? Where did we teach the children to go for riding? We have teach them for driving. We did not teach them for riding. Where did we teach them for kabaddis? Where did we teach them for this? Where did we brought a culture in our house that we should sit together without mobile? Even in the dinner table, I see, even in my class time, I see people are more busy with mobile phone. Then, and when you study classes from the integrative medicine of Australia, where Ashmi is to teach, it teaches us how mobile has destroyed our life. Many such experiments were done about mobile radiation. And we did not understand how much we have hampered our life by just becoming of mobile addiction. We are talking with strangers, we do not know how to talk with family members. And all these things, hatredness in our mind, has created a disease. We do not read less about the disease, more about symptoms. And then we always try to reduce the symptom by this means or by that means. We never understood the pathology from disease to the pain. How much changes has occurred? We know surgeries, but that also 70% of the surgeons we have seen doing mistake and a lot of mistakes in surgeries. We see physiotherapists doing stretching, but in which kind of cases you need stretching? That also I do not know. Is stretching a solution to the problem? Will it create neural changes inside the brain? Or leg is ruling the brain or brain is ruling the leg? That part I am still confused with. What are we looking for? Are we looking for fortivin in ICU or are we looking for ketamine in ICU? We have made ICU as OT room. No doubt, emergency situation requires emergency drugs, but that does not mean that we take what? Drastic decisions. Sometimes drastic decisions are required, but I don't think so. In all cases, drastic decisions are required. People ask me when I initiated my career, how these dry needles to work. I said, you see how it is working. Earlier, my goal was different. My goal was to revive a patient in just 2 or 3 days and move away to other city. But now my goal is different. My goal is to revive the brain, rewire the neurons, and create neuroplasticity in the brain. Because at that time, nothing was taught to us. We had our own limitations to understand what? The functioning of brain. We never understood the neurochemistry of the brain. We were never told to understand the neuroendocrinology of the brain. Let's talk about the machine. We were never taught what will happen by the impulses created from this system. Now, when people like Dr. Udipong, IP Cherian, when they went to analysis of the studies, they realized, oh, it really works differently on the brain. It is indifferent to what we have thought. That part you have to understand today. What are you looking for and what you want in your studies? You must understand the treatment which is provided by you will result to what? We have to understand these are non-communicable diseases. Diseases are divided into two parts, infection and non-infection. Is stroke an infectious disease or non-infectious disease? But because of the treatment from stroke to the non-caring approach of the attendant of the patient, non-caring approach and advices which should be given in stroke care has led to what? Parkinson's. Unnecessary exercises has led to Parkinson's. Why after the stroke the patient recovered and then after 2 years we come to know there is atrophy in the brain and the patient is synced? If you see in between the history, patient was good. Suddenly he started sinking. He went to the neurologist, Syndopa plus or carbidopa levodopa was prescribed. Thereafter sinking start, he loses his voice, he becomes bedridden, and then more bedridden, and then he sinks and dies. From where did we start and where did we go? From this, I understood that disease can be recovered very easily, provided you have an approach to it, especially in neural side. How my patients of DMD starts working and you say there is no treatment? How my patients start stabilizing in stroke in GCS 5 or 6? How do they get stability? How do they come out from coma scale? I'm not against homeopathy or allopathy or Ayurveda or any other medicine. My only question is, we must understand what they are doing inside the body. I will never be of the opinion that beta blocker or alpha blocker should be stopped. But in Parkinson's patients, when we see bradycardia, we must stop beta blockers. When there is tachycardia, you may keep. But when in Parkinson's, there is bradycardia, means low heartbeat, you have to stop beta blockers. That type of knowledge we should have. Otherwise, slow heartbeat may result to what? Cardiac arrest. That is why the knowledge of pharmacology, the knowledge of physical therapy, the knowledge of dry needles, and the knowledge of orthopedics, the knowledge of neurosurgery, all these words should be there. This is what we give to the surgical student. We make them work in what? Burn unit, this unit, that unit. So that you get an exposure.
वर्मा जी, ये 450 ml की तो बोतल हो गई तैयार। अब मेरी बात सुनो, इसमें से मैं अगर 4.5 ml 5 ml के बदले 10 ml डालता हूँ तो ज्यादा स्ट्रॉन्ग हो जाएगी, ऐसा कुछ है? कितना डालूं ज्यादा से ज्यादा तो स्ट्रॉन्ग हो?
Can you meet Prakash ji? See, as a physician, after a long years of practice, what do we see in our clinic? That we are, it has become tougher and tougher every day. More tougher in coming days. I think after 5 years or 6 years, it will be more tougher for us to recover a disease. 15 years back, I used to see, or 6 years back also, if you see, how it was easy for me to recover a stroke patient. If you go to my videos 6 years back, something have been uploaded in YouTube channels. You'll see within 2 days or 3 days, the patient, bedridden patients used to walk. Fine movements used to arrive in just 5 days of treatment. And today, for the same successive MC and fract, we take months of treatment. How much body physiology has changed. That's what our people used to say. My grandfather and me, we has never done all this. Why you people need to do all this? Because we have become what? At the time of my father, their health was good because they never used to work on mobile so much. And how much time you need to give to mobile? How much unnecessary time we are spending on mobile? Did we ever see? In that time, if you could have studied some topics, instead of putting yourself on social discussions, your mind would have opened that yes, how does a neuroprotein damages the brain? How simple stimulations revive the patient. I still remember a sentence from Dr. Odipong, who was from Pusat. When I assisted him for a single day, he said, when all things failed and when your mother is dying, I started learning acupuncture and I went to China. And then I gave my exams as acupuncture student for 2 years. I studied acupuncture in Thailand and then I gave my exams to pass out. And then I'm today practicing acupuncture as a licensed acupuncturist in Thailand. For what purpose? He said, only a physician will know when his own relatives do not recover. He'll find out. When his own children suffer, he'll find out what else can recover them. And who was to push them to disease was our own self. Our fooding habit, artificial sugar, gluten, dry nuts. We never realized the importance of self-recovery. We always realized what? The damage inside the body. Whether we ourselves wanted to create this damage, and we ourselves is facing the damage. That's the best part I have enjoyed in my clinic, that I use an homeopathic dose of an allopathic medicine. This is what Mohan Singh always teaches us. Low dose of medicine also works very nicely. Monday, Tuesday, Wednesday, I always teach you about acupuncture point. And Thursday, Friday, Saturday, I teach you how these acupuncture points, why all these things are important. What is the importance of that in our life? हमारी जिंदगी में इसका क्या अहमियत है, इम्पोर्टेंस है, उस बात को आज हमें समझना होगा और फिर कदम मिलाकर चलना. I've seen very good recoveries in my own clinic. I've seen patients sinking also in my clinic. We have seen everything from birth to death in our clinic. And then we realized what is good and what is bad. Sometimes we are reluctant to share our experience also. Why? because the recovery has to take place. But are you prepared to bring that recovery? Is your foundation that strong? And now you'll ask me, what should we do? I said, first build your strong foundation. Then only your building will sustain. Recoveries will only come when foundations are strong. Our mind will only, we know we cannot recover 100% of the problems. But even to bring 30% of recovery, 20% of the recoveries, you must understand your foundation should be strong. You must be very well understood how much recovery is possible, how to recover, and what to recover, and what can help you to recover. The best pathway is the pathway, as Dr. B.M. Agri said. We revise the pathol treated by the disease. And there are many ways of going to Rome. It is up to us how we decide to go to Rome. I selected dry needles and then I gave importance to all types of medications, homeopathic, allopathic, herbal, non-herbal. Even I went to the extent of studying flower remedies and I found it helps. In my own case, when I have a severe itching in my throat, I go for rescue remedy. And after 2 minutes, I see, oh, the itchingness is gone. 6 hour itchingness is gone in 1 minute. So I have seen the Totora oil, how effective it is when you put on the surface of the skin. You put it here and you see how much relaxed you get. Whenever I used to go to Malaysia, I used to bring so much of oil for my side. Essential oil, what you want. I was a non-believer of it. But when Rashmi taught me the importance of this in our daily life, I understood everything is important. My ignorance only has created this importance in our life. So I'm just giving you an overall view of what we have taught in 60s. In Saturday, we just discuss that what is a physician? Physician is a person who has been exposed to disease and who knows how to overcome the existing situation to that part of the disease. As nephrologist loves about nephrons, as orthopedic knows about the orthos, different physician knows about different things. And I believe integration of all is required. And that is why whenever I get an opportunity, I study orthopedics, I study neurosurgery. I may need not to do an orthopedic surgery, but I need to understand orthopedic surgery very well. Because tomorrow when an orthopedic complication comes, I must be very well versed with what was done in the patient. As I am well versed with the neuroscience, I must be well versed with Pain management, only if I understand orthopedic neurology. Every orthopedic case which is suffering from pain, shooting pain or anything is a part of orthopedic neurology. So all these things you have to study, understand. And these days the studies are very easy. Type in Google what is orthopedic neurology, you get everything, whatever you want to know. You study this, you get to know neuroplasticity. You go write neurogenesis, you got to know angiogenesis. In our times, it was very difficult to find on papers, books. But today, things are much easier for us to understand. Because we have access to mobile. Tomorrow it will be more easy because we will have 5G. So use that access to your documents, to your own questions. I don't want to teach you from slide, but rather I want to teach you randomly. Why? Because in slides or in a particular video, we are only limited to that form of knowledge. But when we speak like this, we touch variety of topics. From orthopedic neurology to Parkinson's to post-stroke Parkinson's, where the patient has become totally recovered. Again, he suffered from Parkinson's. What kind of recovery is this? You replaced the knee, and then the patient after 3 years, 4 years, suffered from cancer or has become bedridden. What kind of replacement is this? If you don't replace, you give so much painkillers that the patient dies because of renal failure. Somewhere some solutions have to be found. And those solutions only will tell us where are we and how much we have done. How you solve a situation. I saw people advising so many things in physiotherapy, in these, homeopathy and all. With what? Partial knowledge of recovery. After doing this, what you should see, we do not know. After inserting the needle, what you should see, you do not know. First, must plan out what you must want, and then you must plan out what you want to see. And that gives you an idea of recovery of the patient, for which we are sitting together and studying together. Today is a new year time. We don't want to spend so much time because many people have festivals in their homes. Relatives have come. People have also come to meet me. So if you have any questions, you may put up for next 10 or 12 minutes. I'm here in the class. You may ask me your questions. Am I audible?
Yes, sir. I
Yes.
put up 3 questions.
Yeah.
Carry on one by one. One question, one answer. One question, one answer.
That's
Don't
right.
ask me too many questions so that I have to sum up too many answers.
I put up 3 questions there just in case I'm not audible. Yeah, but
Okay.
one at a time, definitely.
Yeah, right. One at a time, please.
First question. How does brain injury or concussion affect one's memory and emotional state of mind? How can MIBS help?
See, whenever there is an infarct or hemorrhagic stroke, what do you injure? You injure the neural network. What did you injure? The neural network. And after you injure the neural network, there are neuroproteins deposited over there. So if you study transcranial magnetic stimulation or transcranial electrical stimulation, We study those research papers. They found out that during this procedure and stimulations, this pathos can be revived. Even in many cases, vagus nerve stimulation was there. A stimulating device was proceeded and implanted in a brain for stimulating the vagus nerve to reduce the seizures. In many cases, it worked wonderfully, and in some cases, it did not work. Similarly, when you fix these electrodes over here, it creates three things. One, it tries to repair the pathos, provided your brain mapping is correct, provided your knowledge of understanding the type of stroke is correct. Because frontal lobe is revived. I told in the video yesterday, frontal lobe is revived for the definition. Now I tell you, oi bastard, what are you doing in the class? The word called bastard is identified with a certain definitions, which leads to a certain meaning. Now you identify yourself with that meaning and then you replicate. Where is this definition? This definition is in frontal cortex, where emotions and all this are stored. Then the reaction of these emotions goes to where? The encephalon. Then comes sympathetic and parasympathetic. How to react to these emotions? Fight, flight, freeze comes under sympathetic. Parasympathetic tells you, oh, the situation is normal, become normal. That's why we say, cool down, calm down. These words, where do they implicate? It implicate what? The vocal sound, temporal lobe, the sympathetic and parasympathetic pathway. Or tiger has run away, cool down. Or the lion has run away, cool down. Everything will be okay, cool down, cool down, cool down. Why are you so hyper? Cool down. So, to summarize this in one sentence, is a emotion, it's an injury inside the brain. And NIBS creates a revival of this injury through stimulation provided in a certain pathway by which the pathos are revived, the neurons get revived, and your activity get revived, and you start what? Going to your previous life. Provided the instrument which you have used is correct, the mapping of the brain is correct, and your understanding of the disease is correct. Am I clear?
I'm clear. So that also includes brain inflammation and also aphasia, right?
See, if aphasia and all this includes which artery has been ruptured, which area of the brain has been damaged, and how progressive damage was there or non-progressive damage was there.
Okay.
Progressive damage means after stroke, 2 years after stroke, he lost his voice. Or at the time of stroke, he lost his voice.
Okay, so is there any complication to take note?
The most important thing is the post-treatment complications. Whatever treatment you have decided to do on the patient, whether it is acupuncture or anything, because brain is already tensed. Any of your decisions may create what? Misery in the life of the patient. Future misery. You may have saved his life, but you have added misery to his life. So, whatever treatment you select, it has a neural impact, whether it's physiotherapy, whether it's acupuncture, whether it is homeopathy, whether any medicine. If they affect, they also have a negative effect in our body. A wrong choice, wrong selections, with little knowledge will always damage the things. in a future. So definitely, the selection of the disease, diagnosing of the disease, and selection of the remedy plays an important role. For example, I have a throat irritation from the morning. I realized it is because of my excessive stress. So if I use flower remedy, rescue remedy, I put two spray, it is gone. But if I do keep doing gargling with salt water, will it sustain? I do not find any relief. Two spray of rescue remedy relieved my throat. So diagnosing and finding a solution under which group of medicines, which group of dose. Because in allopathy, if you see, what do we study for 6 years? First line of treatment, second line of treatment, third line of treatment, fourth line of treatment. What do we study? We study this only. There are more than 1,000 diseases, but we have only 60 medicines, 70 group medicines to revive 1,000 medicines. How much can we revive? To what extent we can sustain? All this must know. Must know our limitations also. We must know our benefits also. It is called strength, weakness, opportunity, and threats. SWOT analysis of the diseased patient.
Okay,
This is
thank
what I
you.
have. I call it SWOT analysis. What is the strength of your disease treatment? What is the weakness of your treatment? What is the opportunity you have? And what are the threats you are going to overcome?
Okay, thank you so much for sharing.
Thank you so much for asking me a beautiful question.
Sir, good evening, sir. This is Ravinder Sangala.
Yes, tell me.
Today, one child came, sir, with ataxia, motor coordination, loss of motor coordination due to cerebellar sensory neuropathy, sir. The MRI is stating that cerebellar sensory neuropathy, sir. Sir, with stem cell administration, it is recoverable, sir. Should I?
See, all we have to see as of now, we are not in a position to suggest what may recover the patient. Because when the patient comes to us, his physiology is to be considered first. What kind of existing situation he is having.
So he's unable to walk independently, sir.
Yeah, he will have all this deficit because he's having neuropathy inside the brain.
Sir.
The myelin sheet of the neurons are damaged, it means what? The neurons are degenerating. No, we have to sit patiently and study this case. Because this is a progressive case and the patient will be bedridden in a future time.
Sir, sir.
It's a type of, we can say, type of motor neuron disease.
Sir, should I bring him, sir?
You can bring anyone, my house is open to all.
Thank you so much.
More questions? Yeah, he asked me for stem cells. I think stem cell is a about healthy, unhealthy. Every person should take stem cells. It's not a medicine. It's a recovery of the system. So stem cell is advised for all the people. More questions?
Excuse me, sir.
Tell me. Hello.
Hello.
Yes, tell me.
Sir, how can the stem cells help in cancer?
Research papers are there. If you go and study, you'll find out how stem cells have been helping cancer patients. Go to scholar.google.com and you will find out a lot of research papers where placebo, double placebo studies were made.
Yes, sir. So I had read it that it doesn't actually cure, but it helps in.
Who told cancer is
chemotherapy.
curable?
Sorry,
In the
sir.
fourth stage of no disease is curable in the third stage or fourth stage or 7 years of the. It is about how to revive the patient and how much quality of life you can improve, how much back you can give life to him.
Yes, sir.
You have destroyed for 7 years, 8 years. Now when the total system is damaged, you want cure.
Okay,
How
sir.
is it possible? And tell me who can give cure in the world? So that's where our study of this needling along with conservative treatment becomes important.
Yes, sir.
Any more questions?
Thank you, sir.
Any more questions?
Namaste, sir. Sir,
Yes, tell me.
I had twice a cesarean, sir. Cesarean section. And after the second cesarean, then in 6 months, I got hemiparesis. Left side, hands, legs. They were 3-4 days. I admitted for hospital. Then I recovered. Numbness is there.
Huh?
Numbness, sir. Left side.
It's okay. Naresh. We feel sometimes numbness is there. We have to see whether really numbness is physical or it is existent psychologically. Because sometimes we feel that our body is not sensitive to the cloth, but then there are 5 clinical tests which we have to do. So we have to prove it by clinical test whether you have a sensory deficit or not. Numbness is sensory deficit. Whether really you can feel the sensation or you cannot feel the sensation. That part you have to study.
Thank you, sir.
More questions? More questions? More questions? Any more questions? So wish you a very happy Ugadi. We call it a new year of, as China has a new year, Chinese New Year. Today we have 3 days festival in Andhra Pradesh and Karnataka and Maharashtra. We call it Ugadi. It's a new year of our. So visitors have visited us. We have to give time to the visitors and patients. So thank you so much for hearing me. I'd like to conclude here.
Pranam Gurudev. Gurudev.
Pranam, sir.
Yugadi Prav ki हार्दिक शुभकामनाएं।
Yugadi wishes to you also.
नौ वर्ष की हार्दिक शुभकामनाएं सर।
Everyone, Happy New Year. Thank you so much. And live in peace.
Happy New Year. Best wishes.
Thank you, Gurudev.
Thank you, sir.
Thank you, Vinay. Thank you, everyone. Everyone, good night, everyone.
Thank you, sir.